I'm just going to walk the group here today through a program run by UNICEF in partnership with Yale and the organization that I run, the Public Good Projects, or PGP. We most often just go by PGP. And to start with, don't worry, I am not going to be showing you a dashboard today. I love dashboards, but I know that we all have seen many of them. So I'm going to be explaining the work that goes on in what's called the Vaccination Demand Observatory, but I won't. This won't be a walkthrough of any particular dashboard. The Vaccination Demand Observatory was just launched a week ago. UNICEF made the official announcement a few days ago, so you may have seen it in the press. And so my goal today is to introduce you to this global system and then to answer any questions that the group may have about it. But as you can see, it's a multi-stakeholder initiative, and its goal is to identify, track, and respond to vaccine hesitancy and misinformation in real time. It's a sustainable global network of infodemiologists. I know many of the attendees here today are very interested in infodemiology. I myself was one of the trainers for WHO's Infodemic Manager training, and just finished training a group at Mercy Corps. So I know a lot of organizations all around the world are attempting to train up infodemiologists. And this is a merger of equitable social listening systems with many partners. And the goal is to inform demand generation for vaccines, help manage misinformation in the infodemic, and mitigate vaccine hesitancy and new vaccine introduction. As I said, the partners are UNICEF. For those of you unfamiliar with the work UNICEF has done in immunizations, prior to this pandemic, it was the world's largest purchaser of vaccines. It currently manages immunization programs in over 100 countries. So it is a very nice complement to WHO. UNICEF has offices in each country and a very large number of staff based in the field. They are headquartered in New York City, but 85% of their staff are actually in communities. My organization, PGP, is a public health nonprofit, and we specialize in cross-sector initiatives and large-scale media monitoring programs. And then, of course, Yale's Institute for Global Health is a specialist in research, monitoring, and evaluation, and has a team focused on vaccine demand led by Dr. Saad Omer. There's 3 pillars to the Vaccination Demand Hub. So as I mentioned, there's social listening and analytics, which is really a customizable portfolio of different systems all meant to work together. There is a Vaccine Acceptance Interventions Lab, or VAIL, which is running large-scale RCTs in multiple countries, as well as real-time A/B testing of messages in multiple countries, and then giving that data to country infodemic managers. And there is also the Field Infodemiologist Training Program, which I can go into a bit more detail on in a couple moments. So to start with social listening, unlike other systems that are out there that are excellent, this system is designed from the community up. It's not designed as a global monitoring system. So because UNICEF has such a significant presence in so many countries around the world and has existing systems, community surveys, community health workers that go door to door, a very large established network of community partners. They have a number of social listening systems, both offline and online, that already exist. So the Vaccination Demand Observatory is an attempt to reconcile all of those systems and bring them into one place, and then combine them with more global monitoring systems, so more public media data monitoring systems. That community level data goes to up to a country infodemic manager, and then, like I mentioned, goes to the global system. So this is really all about programmatic support at the community level. It's meant to complement work being done by WHO and others, not to duplicate it. You can see here some examples of the kinds of data that the system is currently being built to bring in. So a whole range of online and offline and traditional data, in addition to UNICEF's own tools like U-Report and some other systems that many of you are probably already familiar with. Just like the other systems we've talked about today, it heavily uses NPL and AI, but again, that's more on the public media data side than the community survey side. And its whole point is to, in real time, in the state of the infodemic, bring in all this data and not present the Infodemic manager with yet another dashboard, but with actionable insights that they can actually use in their day-to-day job. And this is really how we're imagining that work. This is the Field Infodemiologist training program, which, as I mentioned, is modeled after the Field Epidemiologist training program created by CDC and in partnership with many countries all around the world, a highly successful program. So this is what this is planned to be. It's not running yet, but it will be running soon. So it's a year-long program for fellows, so people can apply to this program, and in a series of 3-month modules, we'll learn all aspects of infodemiology, and again, designed much the same way that the FETP program is currently running in over 80 countries around the world. Individuals can apply from their home institution. They may work at UNICEF, but they probably won't. They may work at a Ministry of Health, or they may work at other organizations. And they can be housed within UNICEF's in-country office or within their home institution, whichever one is fine. Like I mentioned, it's built off of the infodemiology training that WHO instituted in 2020. All of us here today, I'm sure, are big fans of that training. And so it's that training built out significantly more. In the headquarters of the Vaccination Demand Observatory, the lab will exist, the creative studio testing messages and creating messages, and then the FITP program. That support will then go to regional UNICEF offices and then, of course, down to country offices. I won't go too much into these slides, just to go a little bit more into detail in the lab. The thinking here is the country infodemic manager sees misinformation spiking. They send that alert to the lab. The lab then offers strategic communications guidance and communications templates. Those go to UNICEF country offices, in addition at the same time with their national partners, community partners, and global partners. So this is really meant as a modeling, like a crisis response type system or methodology, but designed for all vaccines and not just COVID-19 vaccines, although of course that's the priority at the moment. Our work to date, numerous webinars, the links are available here. This presentation is available to you all in case you've missed a slide. Don't worry, you'll have this presentation. And then we released the Vaccine Misinformation Management Field Guide in numerous languages: English, French, Spanish, Arabic, Portuguese, and Italian so far. It's been downloaded about 7,000 times since it's been put up, so very high interest in this sort of work. Some of you may have downloaded it yourselves, and so this work will continue in kind of in this fashion. And we are providing in-country support to UNICEF country offices in numerous countries. We started with the 4 that you see here, and we've included a few more since then. And it's been interesting to work with people. All of you work in public health. All of you, thank you. All of you work in public health, so you don't need to be told, but I think those of us working in public health are wearing multiple hats right now. We all have multiple jobs. And so this effort really focuses on how can we make insights as actionable as possible for operations. And yes, there are dashboards. So if you go to this website here and you request access, you can get access to the global dashboard, which is in beta right now, but which provides insights on vaccine-related public media data at the regional level. And I'll go ahead and stop there.